Well, folks, it's a pleasant good morning from Painesville. I'm Daniel Ankara. Welcome. This is the official newscast from the Liberia National Television. Thanks to all of you for following. Top stories this morning. Health authorities in Monrovia says Liberia now has 14 confirmed cases of the virus. Liberian Senate adjourns for 2 weeks Easter break. The Liberian National Red Cross Society launches COVID-19 response with a call on Liberians to adhere to all of the preventive measures. And away from home, Libya's former interim Prime Minister Mahmoud Jibril dies of coronavirus in the Egyptian capital, Cairo. These stories plus much more are coming up this morning. After this break, we will be right back. Welcome back to LNTV News Live. Liberia has recorded another case of the coronavirus, bringing the number of cases to 14. Health Minister Dr. Wilhelmina Jala said the 14th case was recorded following testing of several people suspected of having the virus. Dr. Jala spoke Monday at the Incident Management Team press conference held at the Ministry of Health.
Let me talk to you this morning about the 3 deaths that we have. So when you look at 14 cases and 3 deaths, maybe your interpretation will be different. The 3 deaths, one of them died at home. That person was sick, did not know they had COVID-19 until they started having difficulty breathing in the house. By the time anybody could get there or before they could get to any facility, they had died. The other 2 cases, they got to the hospital when one of them was already in a coma, and then they were having difficulty breathing and they died. None of these cases reached the 14 military hospital to be cared for by our medical team. It's quite unfortunate that we remain in our homes for a long time before we seek care, and then when you get to care, it's late. COVID-19, the death rate is very low, but if you delay at home until you become critical, then there's nothing anybody can do for you. Also, if you are a diabetic, hypertensive, have hepatitis, and there are a lot of other comorbidities added to your illness, if COVID-19 attacks you, most likely you will succumb to it.
The incident management team says there are 8 active cases and the death toll is still at 3. Liberia's Chief Medical Officer, Dr. Francis Kete, said 661 contacts have been traced so far. He spoke Monday as part of the incident management team's press conference in Monrovia.
Out of the 661, we have 353 of them that have completed their 14 days. So personally, there are about 308 contacts that we are. But as long as we have a new case, that case generates contact. So our field officers now have to go from place to place to make sure that we get all of these contacts, we land list them, and we follow them up. And those that are higher risk, we make sure that we take all of the precautionary measures so that we can get them to the right place. And if we get a sample from them and they are positive or negative, we take the next course of action. With that being said, today press conference is going to be very short because we have so much to do. And so We want to again inform the general population that it takes every one of us working together to make sure that we contain this. It doesn't matter how much resources we have, but if we do not work together and we go through the phase that we went through, prior to Ebola, when we first started Ebola, and what happens later on, we don't want to get to that place. We as Liberians should begin to set example because we know what Ebola did to us. And so please, it's an appeal to everyone to work along with us, from the religious leaders to government officials to everyone, the common citizen. Everyone have to work together so that together we can get rid of this.
The leadership of the Liberian National Physicians Assistants Association wants health workers to investigate all clients seeking medication at various health centers to prevent the health workers themselves from contracting the virus. In a statement released in Painesville Monday, the association said as the number of COVID-19 cases increase in Liberia, not all contacts are known to health authorities and is thereby calling on health workers to exercise care. The association's vice president, Wisiri Wolopa, read the statement.
Notwithstanding, we still strongly believe that some may have been left untraced due to lack of information about their point of immediate contact and existence within Mosorado and its environs. LIMBA being concerned about the well-being of our members and the general populace at this critical period, and knowing the virus is not a respecter of person and the virus poses and the danger posed to the health workforce of Liberia from such public health crisis, we have decided to bring to your attention that amidst the current coronavirus pandemic in Liberia, let us use the past EBD crisis to remind ourselves about those common mistakes that got others infected. Let us remember our citizens depend largely on us for their health and safety at such moment in our history. Let us remember that not all the contact from the 13 cases will be easily traced, and it is our duty to investigate all clients seeking health services at our various health facilities about their contact and sound subjective of COVID-19. Let us
In keeping with the Senate Standing Rules 4, Section 3, the Liberian Senate Monday announced the closure of its session for Easter break. The disclosure was made by the presiding officer and Chairman Executive Sir Joseph following adjournment of session yesterday.
The Senate leadership will continue to work, although we are closed today for the Easter break. We are going for Easter break. Approximately going to be for 2 weeks. We resume officially back on the 20th of this same month, April. And I think the senators have been working very well, working very hard. And I think we should give them a break. Senators are also concerned what is happening in the country. They are following it. In fact, leadership will be also sitting down with the executive to know the plan of action of central government or what they're going to be doing. There are a lot of things to be concerned about. If you lock down the place, which county are you going to lock down? Mosorado and Magidi. Don't also forget other counties depend on Mosorado County to survive. How do you take food commodities, gasoline to all of those counties? The welfare of our people. So if you're going to lock down, there are a lot of things you have to put in place. There should be water running. How do we have electricity running 24/7?
The Senate Committee on Ways, Means, Finance and Budget has reported two plenary loan agreements between Liberia and development partners. The loan agreement was sent by the President to the House of Representatives before being forwarded to the Senate. Senate Deputy Secretary Genevieve Masako has been reading through the communication.
From the Communal Ways, Main Finance and Budget on a loan agreement between the Republic of Liberia and Abu Dhabi Fund for Development to finance Ruwaji hydropower project. Recommendation. The Communal Ways, Main Finance and Budget, after careful scrutiny of the loan instruments, the loan agreement between the Republic of Liberia and the Abu Dhabi Fund for Development recommends the plan of the Liberia Senate this agreement for ratification to help assist the development agenda of the government. Signed, Senator Peter Coleman, signed Senator Henry Yala, signed Senator George Temwell, signed Senator Malfi J, and signed Senator Councilor Morris Tuma.
The Liberia National Red Cross Society has launched its COVID-19 response activities in Liberia. The initiative is aimed at helping the Liberian government in the fight. Speaking Monday at the launch, Red Cross President Jerome Clark called for support to enable the Red Cross carry out its mandate.
We have made several interventions ranging from the distribution of hand-washing buckets, dignity kits, and other IPC materials aimed at promoting best hygiene practices. The interventions from the time of preparedness to response phase have directly been made using materials from our stock. At present, we continue to receive hundreds of requests from the communities and other vulnerable groups for support. The requests for food, non-food items, and IPC materials currently on our decks are 10 times more than we can afford at the moment because of the depletion of our stock. We need to quickly replenish, not to forsake the communities. But we are also overstretched because our donors, including countries that always help us, are also overwhelmed with this global pandemic, something which continues to limit our support for this response. We are extremely challenged, ladies and gentlemen. Even in the spread of the COVID-19 pandemic has also made other existing humanitarian needs in the country more acute, further making the delivery of humanitarian aid more critical and urgent. Affected communities, populations to stay home, and people with special needs, including people with disabilities and vulnerabilities, are all really struggling and could be at even greater risk if nothing is done to address the pressing needs. Vulnerable people are in disaster-prone areas, also among those most exposed to infection, least able to access food and health care, and most impacted by loss of income. They must not be forgotten.
Also speaking was Christopher Johnson, National Society Development Program focal person on COVID-19, who said the intervention will help contain the virus.
We have made several interventions ranging from donation to distribution of infection prevention and control materials to the public and also to private institutions, including the WASH Commission of Liberia, the Monrovia Central Prison, the media, and the communities we serve, ranging from the distribution of hand-washing buckets to the distribution of dignity kits, thermometers, and other IPC materials. Before the pronouncement of Liberia's first 2 confirmed COVID-19 cases on March 16 and 17 respectively by the government of Liberia, the Liberian Red Cross has been working with its existing national and international structures in the government of Liberia through the National Public Health Institute of Liberia, the Ministry of Health, and the National Disaster Management Agency, the NDMA, to present a well-prepared national platform for response. We are part of the national coordination efforts, working with sector and pillar actors to provide preparedness and response support. In the preparedness phase of our planning, we have been able to mobilize our network of 3,500 community-based volunteers across the 15 counties through our chapter offices in the counties, trained up to 80 of treating up to 80 of them in most.
And if you're just coming our way, this is a reminder that you're watching LNTV News Live. I'm Daniel Ankara. Top stories this morning: health authorities announce another case, bringing the total number of cases of coronavirus in Liberia to 14. Liberian Senate adjourns for 2-week Easter break. Liberia National Red Cross Society launches COVID-19 response with a call on Liberians to adhere to all measures to prevent the spread of coronavirus. And in Libya, former interim Prime Minister Mahmoud Jibril dies of coronavirus in the Egyptian capital, Cairo. When we come back from the break, more stories are up. Keep watching. Well, a man who has been mentally challenged for 8 years is currently recovering from his illness after being prayed for by a prophet. The man, only identified as Rufus, was frequently seen around ERW hospital fans. Speaking to ELBC Monday in Pinsville, Prophet Emmanuel Living Fire said Rufus developed his mental problem at age 27 before he encountered him.
He said, pray for him. His time being here have overdue. Pray for him, let him be restored. So I went to him, I laid my hand on his head, and I prayed. After 15 minutes, I left him and I crossed the road. On my way coming, I was exhausted. So when I came that night, after praying 2 o'clock in the night, I dozed up to sleep for a little bit. Then I saw this man sitting on my side. And the Lord told me, he said, you see beside you? I said, yes. He said, that man need to be restored. So I'm giving you the task. Go and bring him out. His time overdue.
Was that told you by him or
Yes.
something you know?
Yes, he told me at the age of 27, he got married. And 8 year plus the 8 year, and now he's about 35 years old. Are you getting me? So he has spent 8 years on this madness. He's now, by the grace of God, the demon had left, but he had left with psychological problem that we need to see the psychiatry after the delivery, that they can attend to him in that area. He need to be treated as well. But the madness which kept him on one spot, by the grace of God, that spirit had left, and he's only going 14 days delivering by the grace of God. He speak to you sounds and you ask him for his name, you call his name, you greet him.
Well, LNTV has also managed to squeeze the conversation with the former mentally challenged man, Rufus.
One time coming so
you see that all the things are on the earth doing things. All I want to do.
They asking you who wish you. They asking you who wish you.
I don't know.
Where am I in your path? You still know them?
All are there when I tell you.
Where am I?
I think all do my mother in a got it.
Where am I?
Pa in a wedding.
Probably in Nana.
All living to sing one place.
Where are they living?
We all living on the other one.
What a turning.
When you see your man and pa, you know them.
But
When you see your man apart, you know them. Look at them.
Look at them. When you see your pa running, you know him.
Liberians from all walks of life are joining efforts with government in the fight against coronavirus in the country. The country now has 14 recorded confirmed cases, with 3 deaths and several related contacts being traced. Former District 13 Representative candidate Mama Kizel Sika has been visiting several communities in the district to distribute preventive materials and to create awareness.
We're just here to add our voice to government and the international community that the coronavirus is very real. It's real, it's killing mankind. It's killing not just white people, it's killing black people. And it's in Liberia. They have already known. You see here, that is symptoms here of the coronavirus. Yeah, that is.
We sincerely apologize for the poor quality of that video. Agriculture Minister Jenny Cooper says government has endorsed plans to keep Liberia food secure during the COVID-19 pandemic. According to Madam Cooper, this will involve the collective efforts of all farmers. She spoke to a team of journalists over the weekend in Monrovia.
So we looked at what stocks we already have in country, not only imported stocks, but cultivation stocks. We have probably 1,000 or 2,000. We produced in 2019 250,000 metric tons of rice, which is still only less than half of what we would consume in a full year. Some of that rice has been consumed, but there's quite a bit of it still available to come on the market. We have 723,000 metric tons of cassava. And we have been looking crop for crop, particularly for our staples, how we can manage this storm. And so we've come up with a plan, and this is a plan that has been endorsed by the government, and the president has given it his full support, that we should first gather, purchase, and process the rice and the cassava that we have available, and do a massive push for cultivating more rice and more cassava and more plantains and more vegetables and more palm oil and more poultry, more fish, and more anything.
The Agriculture, Agro-Processing and Industrial Workers Union of Liberia Secretary General Edwin Cisco wants government prioritize the sector. According to Mr. Cisco, agriculture sector remains one of the most employable sectors, and it could boost the economy when given the needed attention. He made such disclosure over the weekend during the signing of a collective bargaining agreement between the Agriculture Workers Union and the management of Golden Verulium.
We want to take this time to firstly admonish the parties for concluding these negotiations in the midst of a very tough economic situation that has been exacerbated by the COVID-19 virus across the globe. We want to, at this time, make a particular reference to our national government, taking into consideration the agricultural sector of our country being the most employable section or most employable sector outside of government. We will want to take this time to encourage our government and urge our government to ensure that they do everything possible to render the agricultural sector viable in these very troubling times. We first want to thank the President of Liberia, His Excellency Ambassador George Manuia, for appointing a very steward and practical Liberian to the post of Agriculture Minister. We can see from the very first 3 months of our engagement.
Well, for his part, GVL Executive Vice President for Strategic Services Elvis Morris says his management looks forward to an improved working relationship.
I'd like to say thank you to the negotiating team, the union, and those who have helped to have this collective bargaining agreement coming to an end as it is. Management of Golden Verulium Liberia hopes that we can be able to use this document as a tool to make sure we can keep our company running, improve our working status with one another, make sure we can be able to have more development and have more people employed. So far, GVR is very much happy to come at the end of the road with a better understanding with the workers' union, motor worker union, workers' union of GVR to a climax and sign in a documentations that will help us keep the company running as it's supposed to be. I would like to say in my...
Libya's former interim prime minister, in our foreign news now, Minister Mahmoud Jibril has died from the coronavirus. According to his political party, the 67-year-old contracted the virus in Egypt in late March and died at a hospital in Cairo. According, he was in power as head of the International Transitional Council during months of civil war in 2011, which led to the ousting of former long-time ruler Colonel Muammar Gaddafi. And on that notice, I will come to the end of this presentation of LNTV News Live. In our stories this morning, health authorities confirmed 14 cases of the virus. Liberian Senator Jones for 2 weeks Easter break. Liberian National Red Cross Society launches COVID-19 response with a call on Liberians to adhere to all the preventive measures. Away from home, Libya's former interim Prime Minister Mahmoud Jibril dies of coronavirus in Egypt. Thanks to all of you for following. I'm Daniel Ankara. I've anchored this morning's presentation. Have a great day from Pinsville. Bye-bye.
We are project. Liberia. Mama Liberia.
I'm Ledger Hood Rennie, Director General, Liberia Broadcasting System. Let me welcome you to our facility here at LBS. At LBS, we seek to do our work in quietude and in professional ambience so that whatever our clients get from us is nothing but the best. And so we'd like to encourage you to use our media services, our television, our radio, our online presence, so that we can give you the best that your money can give you.
My name is Nathaniel Victor. I'm the head of business and marketing. I want to encourage the public to do business with the Liberia Broadcasting System. The radio covers the entire country, so we can boast of the widest coverage in Liberia. The television have won the best television service in Liberia for more than 2 years. So I want to encourage the public to do business with us. We believe that we can deliver the market.
Our mission is to promote the developmental agenda of the country, while at the same time, our vision is to be the most authentic voice of the Republic of Liberia. We strive for professional excellence in the work that we do. We take our client very serious, and we make sure that you get the best of the services that we can provide when you take advantage of all of the various platforms that we have to enrich your business and promote your activities. So let me encourage you to be a part and use the facilities of the Liberia Broadcasting System.
Naresh Brothers, retailer in consumer electronics, home and office furniture, located on Randall Street, Broad Street, Red Light, Waterside, and 15th Street Sinker, are the sole distributor of Afstron, Addy, H2O,